Have you ever heard of the term hemodialysis? Also, what comes to mind when you hear it? Hemodialysis is not a treatment that most people are familiar with, but there are 340,000 people nationwide who are receiving hemodialysis treatment. That means 1 out of every 360 people in the country is undergoing hemodialysis. This time, for those who are new to it, we will talk about dialysis, which is often difficult to understand. We'll give a thorough explanation so that even people hearing this word for the first time can fully understand it. Hello, thank you for watching this video. Let's learn about health information today at YouTube Medical University. Today's topic is hemodialysis. If you watch this video until the end, I think you'll be able to explain the treatment called hemodialysis to others, so please watch until the end. I'll also briefly introduce some prevention methods. Now let's get right into the explanation. First of all, do you know which organ is affected in people who need hemodialysis? Hemodialysis is a treatment for people whose kidneys are not functioning properly. I think there are many people who aren't very familiar with the organ called the kidney, so I'll give a simple explanation about the kidneys. There are 2 kidneys located symmetrically around your lower back. They're about the size of a fist and have a cute shape, kind of like a broad bean. Actually, while many organs like the liver are covered by a membrane called the peritoneum, the kidneys are not covered by this membrane and are located outside of it. Since the kidneys are located behind the peritoneum, they are called retroperitoneal organs. The kidneys are organs where very fine blood vessels gather, and they function to filter the blood. The blood sent out from the kidneys passes through the abdominal aorta, branches off, and flows into the renal arteries. Blood from the renal artery enters the kidney and flows into the renal corpuscle for filtration. Waste products and excess water are excreted from the body as urine. The kidneys have 5 main functions. The first function is to remove waste products and excess water from the body as urine. The kidneys also reabsorb what the body needs and keep it inside. They truly act as a filtration system for the blood. The second function is to regulate the amount of water and electrolytes in the body. The kidneys help maintain the balance of fluids in the body, as well as the balance of ions such as sodium and potassium. They also help regulate the acidity and alkalinity of the blood. Some of you may have experienced this, but when fish or meat goes bad, it gives off a sharp, sour smell that stings your nose. It's the same for humans. When our health deteriorates, our blood gradually becomes more acidic. This is called acid-base balance in medical terms. It's also known as pH. The third function is blood pressure regulation. The kidneys secrete a substance called renin, which controls the balance of salt and water, thereby regulating blood pressure. The fourth function is that they help in the production of blood. Blood is produced in the bone marrow. The kidneys secrete a blood-stimulating hormone called erythropoietin, which promotes the production of red blood cells in the bone marrow. The fifth function is building strong bones. Calcium is necessary for forming bones and teeth. The kidneys activate vitamin D obtained from food, helping the absorption of calcium from the intestines into the bloodstream and making the bones stronger. Have you come to understand the greatness and importance of the kidneys, an organ you probably don't usually think much about? So, what kind of symptoms would appear if those kidneys became unhealthy? And how is treatment actually carried out in practice? First, let me explain what happens when kidney function deteriorates. To put it simply, you stop being able to urinate. Fluids and waste products build up in your body. Of course, the kidney functions I explained earlier also decline. Your body becomes swollen, you develop anemia, and your bones become brittle, making them more prone to fractures. A disease in which the kidneys gradually deteriorate like this is called end-stage renal failure or chronic renal failure. Unfortunately, with current treatments, the only fundamental cure is to have a kidney transplant. Once you develop it, you have to live with it for the rest of your life. It's truly a frightening disease. People who suffer from chronic renal failure need to undergo a treatment called dialysis. And there are 2 types of dialysis, hemodialysis and peritoneal dialysis. Hemodialysis is a treatment in which blood is taken out of the body and passed through an artificial kidney called a dialyzer to remove waste products that have accumulated in the body. It is a treatment that removes waste products and excess water. The blood that has been cleaned by passing through the dialyzer is returned to the body. On the other hand, peritoneal dialysis is a treatment method that uses the membrane in the patient's own abdomen, called the peritoneum, to remove waste products and excess water from the body. Compared to hemodialysis, peritoneal dialysis requires fewer hospital visits and allows you to perform dialysis according to your lifestyle, making it a more flexible treatment. However, in reality, there are various issues such as infections and a shortage of doctors. According to the results of the 2022 statistical survey by the Japanese Society for Dialysis Therapy, only about 3% of all patients are currently undergoing peritoneal dialysis. This video focuses on the treatment most patients receive. We will explain hemodialysis, taking into account actual clinical practice. At YouTube Medical University, 3 healthcare professionals, including doctors, provide information based on scientific evidence. We share information on preventive medicine and health, so if you subscribe to our channel, it will surely be useful for you. Also, every Tuesday at 9 PM, we hold a regular live session called Anything Health Consultation Room. If you have any consultations or questions, there's an official line URL in the description, so please register from there. In the live session, I'll answer as a healthcare professional and look forward to your participation. Now, I will explain the overview of hemodialysis. Hemodialysis is basically performed at hospitals or clinics, and patients undergo dialysis 3 times a week, with each treatment lasting 4 hours. Some people may be surprised at how often it's done, but while healthy kidneys work for 168 hours a week, dialysis only compensates for about 12 hours, so it's actually on the lower side. Hemodialysis mainly removes waste products and fluids from the blood using 2 main principles. The first principle is diffusion. Substances in the blood move from areas of higher concentration to areas of lower concentration, eventually reaching the same concentration. The dialyzer I mentioned earlier is packed with about 10,000 thin straws. Inside those straws, there are many tiny holes that are too small for blood cells to pass through. During dialysis, substances that need to be removed from the blood, such as potassium and phosphorus, dialysate, a liquid with lower concentrations of these substances, is continuously circulated outside the straws. By circulating dialysate with a lower concentration, waste products in the blood move through the holes in the straw into the dialysate, allowing these wastes to be removed. The second method is ultrafiltration. Ultrafiltration is a process where pressure is applied to push from the blood side and pull from the dialysate side, allowing excess water in the blood to be removed. The guidelines recommend that the rate of weight gain should ideally be within 6%. In other words, if your weight increases by 6% for someone who weighs 60 kilograms, that means removing as much as 3.6 kilograms of fluid in 4 hours. Next, I will explain the actual process of hemodialysis treatment. First, the patient measures their weight before and after hemodialysis treatment. Measuring weight is very important to determine how much fluid will be removed during that day's dialysis. Each patient has what is called a dry weight. The best weight is set for each individual. The dry weight is determined based on various factors such as X-rays, blood tests, blood pressure, and swelling. It is determined based on the results of these tests and symptoms. If the dry weight is set too strictly, your blood pressure may drop or you may get muscle cramps. On the other hand, if the dry weight is set too loosely, your body will retain too much fluid. This puts a strain on your heart. Since dry weight needs to be adjusted as necessary, regular X-rays and blood tests are required. I got a bit off topic, but after finishing weighing yourself, you move to the bed and start preparing for dialysis treatment. First, before the treatment, we measure your blood pressure and pulse and ask about your symptoms. Depending on your symptoms, it may be necessary to change the treatment conditions, so if you notice any changes, it's important to report them to the staff. Now we will begin the dialysis treatment. For dialysis, patients have an arteriovenous fistula created in their arm. An arteriovenous fistula is a surgical connection between an artery and a vein in the arm. By directing the blood flowing through the artery into the connected vein, this creates access for dialysis. However, there are some people who cannot have an arteriovenous fistula created due to problems with their blood vessels or heart. For those people, a catheter is inserted into the neck or leg, and dialysis is performed through that catheter. 2 needles are inserted into the shunt, one for drawing blood out, the withdrawal side, and one for returning blood, the return side. Once the 2 needles are inserted into the shunt, the blood circuit is connected to the needles, and the blood is circulated slowly. In advance, the dialysis time and the size of the dialyzer are determined for each patient individually. The blood circulation speed is determined, treatment conditions are set, and dialysis treatment begins. During dialysis, blood pressure is measured and checked regularly, but many people spend their time watching TV, reading books or newspapers, or sleeping. Dialysis ends when the set dialysis time is up and the specified amount of fluid has been removed. By the way, do you all remember the role of the kidneys that I explained at the beginning? In this treatment, the kidney functions that can be replaced are the removal of waste products and fluids and the regulation of electrolytes. That means that erythropoietin production and vitamin D activation are not supplemented by hemodialysis. Therefore, for patients who lack these two functions, we supplement them with medication during the return of blood. The blood is returned to the body diluted with physiological saline, which has an osmotic pressure similar to blood. After blood is returned and there are no issues with blood pressure or condition, post-dialysis weight is measured and treatment is safely finished. This is the entire process of an actual hemodialysis treatment. Did you all get a better idea of what dialysis is like? Since this treatment needs to be done 3 times a week, it takes a lot of time, and considering that patients have to have 2 needles inserted each time, you can understand how much of a burden it is for them. So, is there any way to prevent chronic kidney failure? First, let's take a look at the 2022 statistical survey by the Japanese Society for Dialysis Therapy. In 2022, the most common underlying disease among chronic dialysis patients was diabetic nephropathy, accounting for 39.5%. In other words, most people with chronic kidney failure develop secondary kidney disease after having diabetes and then move on to dialysis. This time, I would like to explain the prevention methods for secondary kidney disease based on the guidelines. ガイドラインに基づいて解説していきたいと思います。The first is blood pressure management. Several observational studies have shown that high blood pressure is a risk factor for chronic kidney failure, so managing blood pressure is extremely important in preventing chronic kidney failure. If you have high blood pressure for a long period of time, the blood vessels in your kidneys will gradually become harder and your kidney function will deteriorate. By effectively using home blood pressure measurements, you can accurately diagnose high blood pressure. Home blood pressure should be measured twice, once in the morning after waking up and once at night before going to bed while sitting down. Be sure to record all your measured blood pressure values in a blood pressure diary or something similar. For more details about hypertension, Dr. Mandarin provides a thorough explanation. ドクターマンダリンが詳しく解説をしておりますので If you haven't seen it yet, please check it out. Let's start by getting to know your own body. The second point is moderate exercise. In recent years, the term renal rehabilitation therapy has been attracting attention. There have been several reports that exercise has improved kidney function in people with chronic kidney failure in the pre-dialysis stage. In some facilities, patients even exercise during dialysis treatment. Although there are still some aspects that haven't been clarified, it is becoming clear that exercise is good for the kidneys. Now, how much exercise should you actually do? The renal rehabilitation guidelines recommend aerobic exercise 3 to 5 times per week. And it is recommended to do 20 to 60 minutes of walking, cycling or swimming. Strength training should be done 2 to 3 days a week. It is recommended to do one set of 10 to 15 repetitions adjusted to your individual strength. Specifically, exercises like squats, heel raises, and resistance band training are suggested. Of course, it's important to exercise within your limits. The key is to continue exercising at your own pace. The third point is salt restriction. If you consume too much salt, the sodium in your body increases, making you feel unnecessarily thirsty. For example, when you eat ramen, you often want to drink water with it, right? When excess water accumulates in your body, it can cause swelling and high blood pressure, putting a strain on your heart. In the worst case, it can lead to heart failure. This can be life-threatening, so follow your doctor's instructions and restrict your salt intake. It is recommended to keep your daily salt intake below 6 grams. First, it's important to know how much salt is contained in seasonings and foods. And instead of suddenly reducing your salt intake, it's important to gradually get used to lighter flavors and make it a habit. In addition, you can limit your salt intake by dipping your food in sauce or soy sauce instead of pouring it on, and by avoiding processed and instant foods as much as possible. If you have any tips for limiting salt intake, please share them in the comments section. I think your tips could help others as well. If you want to know more about salt restriction, your comments will also be helpful for future videos, so please leave a comment. Now let me summarize the conclusions about how to prevent chronic kidney disease. First, it's important to know yourself. Make it a habit to measure your blood pressure and keep a record of it. Second, exercise within your limits. If you set the bar too high from the beginning, you won't be able to keep it up, so start exercising little by little. The key is to keep going. Third, limit your salt intake. Keep your daily salt consumption under 6 grams. Understand the salt content in seasonings and other foods, and gradually get used to lighter flavors. Please make sure to remember these 3 key points before you leave today. Whether you give this video a thumbs up or a thumbs down, your feedback will help us improve in the future, so please take a moment to rate it.